So how is all of this activity in Washington affecting stocks? It's time to buy. Here with more or less funk later, healthcare strategist with Miller Tabak, and Cheryl Skolnick, managing director with Pali Capital Research. Cheryl, I'll start with you.
Great, thank you.
Does this change anything in terms of what stocks to buy or sell?
Well, I think so. It makes it much more certain. We now have something we can actually analyze, which has been a little bit of a challenge with the moving targets we've seen. And I think it's pretty clear that we're beginning to see the bid come back into the hospital stocks in particular, certainly into the managed care stocks, but I'll cede that to Les, as the certainty of some reform, and our view being that given the structure of both bills, any reform is good reform so long as we get something better than Medicare rates for hospitals. So I'm actually pretty excited about that, especially when combined with the signing last night by the president of the COBRA extension that hospitals could have a pretty good first half despite all of the worries we've had about the economy and the uninsured.
Les, how do you see it?
I agree, actually. The bill, the scope of the bill is narrowed such that I think even, although it's still not clearly quantifiable, we should be able to at least make statements that it's not as bad as investors expected, and the underlying fundamentals in much of the group are improving. And so given that valuations are highly below, if you will, historical valuations, there's plenty of room for multiple expansion.
So Les, moving forward, I mean, do you believe that further cost cutting is on the agenda? Because this bill that goes through isn't really liked by either the left or the right, is it? There's still work to do as far as many people are concerned on Capitol Hill.
Right. There is plenty of there are further hurdles, but the reality is this is about as good as we're going to get, and I don't think, at least from the discussions we've had with the folks in Washington, that they can vary too much from what's come out of the Senate in order to get it passed.
So how would you...
Obviously, if nothing passes, that would also lead to upside to stocks, although that would have policy implications.
So what are your preferred picks within that then, Les?
Well, we like United and Humana in the HMO group, although, quite frankly, the group is so highly correlated that most of them, assuming fundamentals stay as they are, should do well.
Cheryl, you feel Tenet is ideally or at least best situated here?
I do. I think Tenet is the only company where I can actually identify a strategy to dramatically change the way in which care is delivered to both improve outcome and lower costs on a doctor-by-doctor basis. And I think that they're best positioned as a result of that to negotiate with managed care companies from a position of higher quality care going forward. I'll point out a couple of other things. With reform, I think also we could see HCA come public again. I feel very strongly that that's in the cards, followed by perhaps IASIS and Vanguard, two other smaller hospital companies. We could begin to see additional M&A in both the hospital and managed care space. But I'm going to sound a warning, and a pretty strong one, about managed care. The devil is in the details in both of these bills. The regulations that will be imposed on these managed care companies are significant once coverage is extended. And over the long term, investors need to really understand that they may well be buying a regulated utility.
All right. Thank you very much.